Dyspepsia or indigestion. It is a group of symptoms in which there is burning pain in the epigastrium, there is distension of the upper abdominal zone, nausea, vomiting, bloating, belching. These are the initial symptoms in acute dyspepsia. When this disease becomes chronic, it may cause alarm symptoms which are very critical and also alarming in sense there is hematemesis, melena, loss of appetite, loss of weight, early satiety, anemia, iron deficiency anemia, and vitamin B12 anemia, jaundice. These are the symptoms in chronic dyspepsia. There is also dysphagia, that is difficulty in swallowing the food material. The etiology of these symptoms are esophagitis due to GERD, that is regurgitation of the acidic gastric material into the esophagus due to weakness and relaxation of the lower esophageal sphincter. Then there are gastritis, peptic ulcer, that is gastric ulcer, duodenal ulcer. Also there is chronic inflammation of the small and large intestine, duodenum and jejunum ileum, chronic inflammatory diseases of these small gut, and also the colorectal carcinoma. These are the various etiological factors producing the symptoms like burning, heartburn in the epigastrium, and the distension of the upper abdominal area. Now, there is also other factors which are not in the GIT tract but in the abdominal cavity, that is the pancreatitis, cholecystitis, hepatitis. These are all pathologies producing pain in the and burning sensation in the epigastrium. That produce the dyspepsia. Now, the investigations. This disease is divided in two categories. The person below 50 years, they need only personal history and the routine inspection, palpation and the auscultation, examination of the healthcare professionals, and they need medical treatment. While the persons who are above 50, they need investigation through endoscopic examination. Endoscope is an electronic device fitted with light and video camera to detect the ulcers, tumors and other chronic inflammation of the small and lower gut. It is also used to get biopsy for histological study in the laboratory to detect whether the pathology is chronic inflammatory or is a carcinogenic one. Now next is the other risk factors, that is excessive use of alcohol, smoking, excessive intake of caffeine, and also the prolonged use of NSAID medicines and corticosteroids. The medicine used for chronic diseases like diabetes, hypertension, heart diseases, and acute renal failure, they also produces the symptom like dyspepsia. Now the treatment is divided into three categories. Antacid, these includes magnesium and aluminum trioxide. Antacid, these reduces the acidity of the gastric contents. Aluminum and magnesium trisilicate hydroxide, these are the antacids. Next is the H2 antagonist. They include famotidine, cimetidine, and ranitidine. These are the drugs which are used orally in the form of tablets or syrups. Next is the PPI, proton pump inhibitors. This includes a group of medicines: omeprazole, esomeprazole, lansoprazole, etc. So these are the drugs which are used to reduce the symptoms of the dyspepsia in acute and chronic stages. Next is the management of the and prevention of the dyspepsia. That is, you have to use Mediterranean diet, that is, which consists of green leafy vegetables and the fresh fruit. You should have regular aerobic exercise, plenty of water, rehydrate yourself, avoid dehydration. So these are, and also the main and the foremost factor is neurological and psychological factor, that is depression, stress, and anxiety. You have to avoid and reduce these factors by maintaining the yoga exercises or the meditation and other useful hobbies to relax yourself and to provide a suitable and comfortable atmosphere psychologically. So these are the various steps which are used in the treatment of dyspepsia, which is a very troublesome and also produces disturbance in the daily life activities of the patient.